This is a 46-year-old man that was referred to Mount Sinai Medical Center from Jamaica, and he gave a 3-month history of chest pain and shoulder pain that had been increasing for the previous 3 weeks. A heart murmur had been heard for 20 years, according to him. He had a history of smoking and of moderate ethanol consumption. ECG revealed non-specific STT segment abnormalities. A chest radiograph was a frontal chest rentgenogram revealed multiple aneurysms of proximal pulmonary arteries with oligemic lungs. The heart was slightly enlarged. One has to include in the differential diagnosis Behçet syndrome and the possibility, obviously, of chronic pulmonary thromboembolism. CT pulmonary angiograms revealed markedly enlarged proximal central pulmonary arteries, but surprisingly no filling defects could be observed. Note also some ground glass appearance of the lung parenchyma, particularly in the right lung, and some mosaic perfusion is also seen. There are areas of oligemia, particularly in the periphery of the left lower lobe and right upper lobe. Mediastinal windows reveal dilated pulmonary arteries and some areas of narrowing of the pulmonary arteries were also observed, but no filling defects could be demonstrated. The pulmonary trunk was quite large. Note that it is larger than the ascending. Other images revealed enlarged pulmonary arteries with areas of narrowing, sometimes proximally or distal to the dilated vessels. Surprisingly, no filling defects were observed. A right heart catheterization study was performed following by selective pulmonary arteriography. The pressures in the right ventricle were 47/2 with a mean of 17. The right atrial pressure was 9/1 with a mean of 5, but the right and left pulmonary artery pressures were quite high, the right being 98/20 and the left 106/22. Representative images of right and left pulmonary angiographic examination, digital recording revealed the ectasia of pulmonary arteries, tortuosity of these vessels, and areas of narrowing proximally and distally to the areas of dilation. We could not identify filling defects. This patient had angioscopy, and the study did not reveal the presence of chronic pulmonary thromboembolism. We don't have a final diagnosis in this case. It is being considered an example of vasculitis of indeterminate origin.